The third part of this module covers impact on well-being. The last part of module 2 covers impact on well-being. We reflect especially on water-related mental health stressors, including climate change. We also dive deeper into gender-based water violence, a significant issue impacting women and girls across the world who are responsible for collecting water for their households. Mental health is a fundamental component of a complete state of health and well-being. But what is mental health? The World Health Organization defined mental health as the state of well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. When individual vulnerabilities interact with stressors, they can lead to mental health conditions. Mental health is becoming a serious concern in the WASH sector as it is more widely recognized how water-related stressors can contribute to long-term mental disorders such as depression and post-traumatic stress. Examples of water-related stressors include climate change, water insecurity, poor wash access, gender-based violence, and conflict. All this notably can be further worsened by climate change. A critical water-related domain that can worsen mental health issues or trigger it is climate change. And this happens through a variety of pathways, such as environmental degradation and displacement, rising sea levels, coastal erosion, and desertification. The World Health Organization noted 4 significant climate change linkages to poor health. The first is the natural events and trauma. Where climate change increases the frequency and intensity of extreme weather events like hurricanes, floods, wildfires, and heat waves. These events can result in significant trauma, loss of property, displacement, injury, and loss of loved ones, leading to acute stress disorders, post-traumatic stress disorders, PTSD, anxiety, and depression. Loss of livelihood and economic insecurity. Climate change can disrupt ecosystems, agriculture, and livelihoods, particularly in vulnerable communities dependent on natural resources. Loss of livelihoods, food insecurity, and economic instability resulting from climate-related events can lead to chronic stress, anxiety, and depression. Also, psychological impact of climate change awareness. Awareness of climate change impacts, coupled with feelings of helplessness, Eco-anxiety and existential dread about the future can contribute to mental health issues such as depression, anxiety, and despair, particularly among the younger generations. Last but not the least, social disruption and conflict. Climate change induced environmental stressors, resource scarcity, and competition for land and water can worsen social tensions and conflicts, leading to displacement and therefore loss of cultural identity, community breakdown, and violence in some situations. Due to poor social health, people have expressed feelings of fear, mistrust, and distress. Another significant impact on well-being is the increased risk of gender-based water violence. Research has indicated that gender-based water violence is associated with water insecurity within the household and at a community level when largely women and girls walk to water collection points and collect water at these communal sources. A global review conducted by Talman et al. Published in 2022 found that there are 4 types of gender-based violence associated with women and girls providing household water, namely verbal, physical, sexual, and economic violence. The most common form is the risk of sexual violence while accessing water sources. Experience of verbal abuse, physical attacks, and even kidnapping, sexual harassment and assault, including rape, on women and girls were the most reported because assailants knew when to attack, given the predictability of gathering schedules, and where to attack, as collection points tend to be in isolated areas that are not well lit. Verbal and physical abuse was documented amongst people collecting water and behind closed doors within households, as male partners often penalize women and girls for failing to meet household water needs. And when older generations enforced gender water collection roles amongst younger generations and daughters-in-law. The latter point speaks to economic violations, as the overall opportunity cost that women and girls experience, as every hour spent carrying water means an hour of school or work is lost. A further economic violation is when women and girls are coerced into transactional sex by males controlling water points as water vendors. In summary, gender-based water violence results in major physical, social, and mental well-being consequences. On the latter especially, it is well documented that water insecurity can directly or indirectly trigger mental related disorders such as depression or post-traumatic stress syndrome. So far, we have discussed a range of ways that the water and health sectors are linked to target programming, but addressing critical gaps can also be a strategic way to enjoy the benefits of good water, health, and well-being. The most important gap that will have significant health benefit for all is achieving universal access to safe wash. to safe water services needs to be human-centered in design. It must involve meaningful engagement of communities using the services and those managing and supporting the operations and maintenance over time. Also, establishing partnerships and collaborations to support capital provision and long-term operation and maintenance have been critical to ensuring WASH infrastructure stays functional over time. Another critical aspect to ensure the longevity of water services is to adopt sustainable development approaches and practices to build climate resilience. Additionally, most WASH infrastructure and systems were developed in a pre-anthropogenic climate change era. So, it is important to support technologies and innovations that shift how we design and use WASH daily to mitigate health risks in the face of climate change. To our heart is the need for greater equality and inclusion in services, making sure especially that women and girls no longer experience gender-based water violence and stop missing out on educational and economic opportunities, and that marginalized populations no longer lose their lives or productive hours due to preventable diseases. To achieve this, we must target behaviors and break down structural determinants such as social norms contributing to inequality and exclusion. Finally, we need more evidence-driven policies that are interdisciplinary in substance and promote cross-sectoral action. To know what works and what doesn't, we need to collect data and monitor policy and practice in research projects that will hopefully drive change. While we have covered many great water and health actions, there is still so much scope to continue to improve so we can reach more people, especially those in marginalized or overlooked populations. This is a key gap in policy and practice. We therefore want to close this course by highlighting the intersectional and intentional lenses that should be the backbone of all action to ensure that no one is left behind and that development is both equitable and sustainable. What we learned from water and sanitation safety planning, the best framework for neglected tropical diseases, and WASH in healthcare facilities programming is that all actions should be comprehensively planned through human-centered approaches, in the sense that they should be designed for humans who need, use, and manage water and health services for greater inclusivity. In addition, the HWISE skills demonstrates the value of unpacking water security from multiple perspectives to build resilience by challenging conventional framing and methods to rethink water solutions based on specific health needs. We especially need to do this to tackle water-related mental health issues that require a holistic approach. Research on gender-based water violence highlights the need to mainstream gender, equity, and inclusion measures to improve the lives and security of women and girls across the globe. Lastly, each action demonstrates the value of working across disciplines and sectors by applying a transdisciplinary lens. Through partnerships and collaborations, we will develop integrated water and health interventions towards a healthy people and planet. This is the conclusion of Module 2. The next module will focus on strategies to enhance water and health concerns, as well as the partnerships and cooperation required to implement these strategies effectively. The module will explore approaches, interventions, and collaborations to improve access to clean water, sanitation, and hygiene practices, ultimately contributing to better public health outcomes. It will also delve into the roles of different stakeholders, including governments, non-governmental organizations, community groups, and international agencies in fostering collaboration and synergy to address water-related health challenges. Overall, the module will emphasize the importance of interdisciplinary efforts and partnerships in achieving sustainable improvements in water and health outcomes. See you in Module 3.